If Mr. Magoo were looking for a Medicare plan today, would he do the same things that he used to do in those old cartoons? You remember Mr. Magoo. He was the guy who could see up close fairly well, but couldn't see anything beyond maybe just a few inches past his face. And he would run into things, he'd crash his car into things, he'd talk to statues, and, we all laughed at him because he was a funny character. But what if Mr. Magoo were looking for a Medicare plan today? Would he have the same challenges and so forth? This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. When a lot of people look for Medicare plans, they have that Mr. Magoo syndrome kind of embedded in them, and they can see stuff that's right there in front of them, but they can't really focus on anything beyond what's going on right now. And this can be a problem if you're very nearsighted when it comes to Medicare plans. A lot of folks are attracted to these plans that, they don't have a premium, and there's no copay for doctor visits, and there's, you can do this, you can go anywhere, and you got dental, and you got vision. Who could ask for more, right? And a lot of times that's the way it's presented. Now, I got news for you. Some of the folks that are out there selling Medicare Advantage plans are kind of taking some shortcuts and liberties, and they're not really going into everything. And the people who are buying these things are sucked in by the fact that there is no premium, there's no copay for this, and get all these added benefits out there, and they don't really look out beyond what's going on right now. I have clients that are turning 65. And, I started asking about what I'm not on any medication. And, okay. Do you go to the doctor? No, I hadn't been to the doctor in years. I've never even been in the hospital, as a matter of fact. And so, they seem to think, a lot of them, not all of them, but they seem to think that whatever your health is today, that's the way it's going to be in the future. And so, I'm looking real strong at these plans that don't have a premium and everything. And I just figure that somewhere down the road, if my health changes, I'll just change over to something else that's more comprehensive. And what they don't realize is that they probably can't do that. If you wait until you get sick to look for a Medicare supplement plan, you may be very, very disappointed. So don't have that Mr. Magoo approach and assume that, it's all, whatever my health is now, that's the way it's going to be for a long time. It may be 10, 15, 20 years before I ever need one of those high-priced Medicare supplement plans. I got news for you. When you get sick on a Medicare Advantage plan, you're going to find a new difference, a new definition of high-priced. When you have to come up with $300 for each radiation treatment or chemotherapy treatment, when you've got to come up with a couple $100 for lab work and for therapy and all this kind of stuff, it'll add up. It'll add up. I have friends that are, oh yeah, man, this is the greatest thing in the world. And it is until you get sick. And at that time, you'd say, man, certainly like to change over to this other thing. And you get a rude awakening. It's like, no, first off, you can't do it right now. You can only do it during open enrollment. And if you can't qualify medically, in other words, if you're too sick that you can't qualify, you're going to end up staying on that Medicare Advantage plan, and most of those plans have $6,000, $7,000 out of pocket. Lots of moving parts. You can go to this doctor, not that doctor. You can go to this clinic, not that clinic. And so all of a sudden, you're getting all these hassles. That plan that you didn't use for so long, you're coming to find out that that Mr. Magoo syndrome has taken over, and now you're surprised. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care and have a good day, and don't get sucked into the Mr. Magoo syndrome. Take care.